Today we're going to talk about reproductive health, reproductive care. Now, one of the most private and personal family matters is again becoming a political hot potato. Reproductive health is very important. It's important for women's general health and their well-being, and it is central to their ability to make choices and decisions about their lives, including when or whether to consider having children. Now, we've heard enough sound bites and political rhetoric. Let's get some facts. My guest today is my friend, Lashell Jones. She is a highly skilled ultrasound specialist in obstetrics and gynecology and fetal echocardiography. She holds the esteemed position of the lead sonographer of Maternal Fetal Associates in Reston, Virginia. She has over 20 years of experience in women's health, prenatal medicine, and fertility. Lashell, welcome to Life Altering Events.
Thank you for having me, Frank.
It's always a pleasure. Lashell and I spoke a few weeks ago, and this story is just intriguing and how much in depth this is. So, Lashell, tell us a little bit about this journey. How did you get into the sonogram field? What led you there?
Well, let's just say ultrasound sort of found me in a way, because when I left for college, I was pursuing physical therapy. And before I could pursue those classes, I had to do some health science classes. And so that was through OB ultrasound. And it was upon taking those classes that I realized I liked it more than what I was actually pursuing. And so I still remember the phone call to my mom, and I said, "Mom, I think I found my passion." And so I was able to change my degree and pursue OB ultrasound. And I must admit, after 20 years in the field, I am so glad that I made that choice, because I truly enjoy it. Still to this day, it's truly a passion of mine.
That's outstanding. So many of us, when we go to college, so young, we don't know what we want to be. We think,
Right.
and then we get there and we find out, well, no, I don't want to do that. And that call to mom and dad's always fun. That's always a fun call.
Right.
It's like shit, because I'm a dad with 2 daughters that went to college, and the first question is always, how much more is this going to cost?
Exactly. And that's what she asked. How much is this going to cost? At
And how much?
least most of their classes were parallel, so it wasn't too much of a difference in costs. And
Good.
so I was lucky. Yeah.
That's it. That's outstanding. But it happens to almost all of us. You don't know what you want at that age. You find out what you don't want, and then you move on.
Right. Exactly.
You work with high risk pregnancies. So many high risk pregnancies. We talked about some. So what role does the sonograph play with these high risk pregnancies, or with any pregnancy?
Oh, it plays an important role, very essential, because we're the first set of eyes. We're able to detect a singleton pregnancy from quintuplets, which is 4. So right away, that's something that you need to know, that information. Not only that, we're able to see genetic issues that may be happening early on. We're able to advise patients to maybe have them take additional testing for chromosome issues that the fetus may have. I feel like ultrasound plays a key role in pregnancy, hands down. I mean, we're able to count fingers and toes. We're witnessing this fetal development with the mom and dad. And so it plays an important role in pregnancy. And I must admit that I'm proud to be a part of that journey with the parents.
You deal with, you told me, you deal with the whole person here. It's not
Exactly.
just the physical part. There's so much more involved in this. Is that right?
Yes, absolutely. I mean, a lot of times we're the listening ear. And so the patients feel comfortable with us to talk with us versus the doctor. And so we're able to relay messages to the doctor for additional care, um, whether it's mentally, whether it's extra prenatal care. And so, yes, it's not just about the fetus. We're also dealing with mom as well. And so it's a whole process that we deal with doing this.
It also helps keep
Yes.
the mom calm because you know what
Hmm.
should be occurring at different
Yes.
levels, correct? And you can kind of guide her. Is that what happens?
Hmm. Yes. Along the
Wow,
way, because a lot of times they they don't have the whole story of what they're actually there for, and so we have to kind of explain the process of what we're doing, and so then they're able to relax more once they know the full story of what we're seeing and why. So yes.
that's outstanding. So many
Hmm.
women, I was a medic in the military and I spent a little bit of time in
Hmm.
OBGYN, very little, but
Yes.
many women have said the anxiety level dramatically increases during pregnancy
Yes.
anyway. Now,
Right.
how much more is that for a high risk pregnancy, which is anybody over 35 years old? Is that right? Is that considered high risk?
Exactly. Exactly. But believe it or not, most of our patients who waited later to start a family are sometimes in their 40s. We even have moms that's in their 50s. So, of course, the older you are, it increases that risk of developing or having a baby with a genetic issue. And so, yes, right away, their anxiety is really high because they heard all of the bad things that
That
goes
could
with that.
happen.
But most of the time is good. Of course, yes, it is some bad, but and so right away they're nervous and they think that something's wrong with the baby before we even evaluate the pregnancy. And so when they come through the doors, they're anxious from the start. And so it's us once again as sonographers to try to ease that anxiety and try to say, okay, we will try to be there for you and we will lead you along the way and make sure that they don't feel left out during the process.
And that's a big deal. My youngest daughter
Yeah.
just had the 12-week
Oh, yeah.
ultrasound, and she was
Mm-hmm.
very stressed out. Is everything going to be fine? Is it a chromosome problem? And
Right.
all these fears that come in,
Mm-hmm.
and you can be the person that sort of calms the waters. Is that right?
Right. Yes, absolutely. I've been told I'm like the baby whisperer with my voice. That's usually what they call me, but it's just because I understand, I too was a mom who was over 35 who had her first kid. So I definitely understand where the anxiety lies. And so I try to be, a common factor for them during the process.
Right. And it's a lot of it is keeping them relaxed,
Yes.
letting them that it's okay. Now, knowledge is power. So what unfortunately not everything goes perfectly. So what's the
Right.
process when something is irregular? What do you do?
So as sonographers, we're not allowed to discuss our findings with the parents. So as a sonographer, we take the pictures. We do all the pictures and the labeling and measurements for the doctor, and we have to discuss our findings with the doctor. It is up to the doctor to come in to confirm what we saw and then talk with the patient and usually advise for procedures to maybe have or extra blood work. So it really just depends. Unfortunately, if there is no heartbeat, then that is my job to tell the parents before the doctor comes in, which is not an easy task, but I still have to do that. Um, so yeah, but other than that, we usually leave everything in the hands of the provider.
That's got to be intense
Yeah.
discussion, particularly with as I've heard one of my nieces. She said, she was 36. She says, "This is it. This is my last
Mm-hmm.
chance." So in addition to all the things that could happen, there's this fear that I may never have another opportunity to become a parent.
Right. It's tough. It's really tough. And for a lot of our patients, it is their last chance too. So unfortunately, if you find a problem that could be lethal or lethal to the fetus, it is a really tough conversation to have.
I'll bet. I'll bet it
Yeah.
is. Now
Hmm.
you worked in fertility for a long time
Yes. Hmm.
in
Did.
IVF. There's a lot
Hmm.
of information floating around out there, and most of it's incorrect. So
Mhm.
what is IVF? What is the process?
The process, a lot of times with IVF, before you actually start the procedure, you have to do a lot of pre-testing before. That's usually where the anxiety really starts for the patient because it's a constant blood work, constant ultrasounds, constant procedures, even before you start the IVF process.
Wow.
Once you start the IVF process, once again, it's more blood work, it's more ultrasounds. So it is an emotional roller coaster for these patients. And then once they start the medications, that causes hormone elevation as well, which causes more anxiety during the process. So it's a stressful journey, and for a lot though, however, it's a rewarding journey at the end. So hopefully everyone will be able to have that rewarding journey, but it is an emotional roller coaster, I must admit.
I can imagine. There's also, I'm
Yeah.
told, there's a very high failure rate. Is that true?
Yeah, yes. Unfortunately, it takes a few times for some patients. Some patients are lucky to have their success story initially, but for most, it is a ongoing journey. So, yes, it's very high failure rate usually.
Is that why that there's multiple eggs that will be fertilized
Hmm.
in the event that one doesn't take? But then hopefully, uh, one does. Is that how it
Yes,
works?
yes, and through the embryo transfer process, they will sometimes insert more than one to increase the chances of conception.
Hmm.
Hmm.
Is that also then a potential for multiple births
Exactly,
if everything were to
exactly. So,
take? Right.
yes, exactly.
Plus, I also
Absolutely.
understand um, most insurance don't cover this. Is that true?
That is true. And so some patients will wipe out their retirement just in order to start a family. Um, a lot of patients pay out of pocket. And so that creates more anxiety during that process as well.
I'll bet.
Yes,
And again, it's
absolutely.
back to it's
Hmm.
often it's like this is a last chance kind of a
Exactly.
situation. When there's that much stress building up,
Hmm.
Michelle, is that have an impact on the pregnancy or the ability to get pregnant?
Absolutely. Absolutely. And even for a mother who's having anxiety and she's pregnant, sometimes that can carry over to the fetus. And
Mm.
we can see a high elevated heart rate just because mom is excited at the time or anxious at the time. So, absolutely, it does carry over. Yes.
And that helps in the preventative. I'm seeing this. You have to tell the doctor, correct, and the doctor, and then try to do some calming. You can't give a lot of medication to pregnant women, I understand, but
Right.
there's
Yeah. So,
other
we try
other
to.
processes that could be
Mhm.
put into play. I guess that's early detection is power. Is that right?
Exactly. Early detection is key because with early detection, you have other procedures that can help with the potential progress of the pregnancy or even with the fertility journey. So, if you usually catch things right away, there is some helping mechanisms that you can do to help.
Hmm. What there's so many there's so many things in a pre-pregnancy when
Hmm.
someone is comes in. Do you have programs or classes that go over this is what to expect, this is what the journey is going to be like in the early
Hmm.
stages? Or is it the mother tends to rely on the book she reads and TikTok memos and all that kind of
And
stuff?
Google.
And Google, oh God, Google,
We always say stay away from Google.
yes.
In the prenatal journey, there is no classes pre classes prior to starting. But with fertility, you do have your fertility nurse that she's like a coach in some
Right,
sort that kind
right.
of coach the patient along. So I have seen that in the IVF setting, but unfortunately, in the prenatal setting, there's usually no free classes, but you have books. I prefer books, honestly, than Google, because
Yes,
Google tends to only put the bad things or the bad stuff, and so that creates more anxiety, which that's not what we're trying to do. We're trying to
exactly.
set a calming factor. So stay away from Google if you can.
Exactly. I've heard doctors, again, my youngest daughter, uh, with an issue she had, it went to Google and she's
Mhm.
calling me up, says, I have cancer. And I said,
Oh
what do you mean?
no.
What do you mean you have cancer? Have you seen a doctor? She said, no, but I read it on Google. Right.
Oh my goodness.
Okay. I said, all right, well,
Dr.
let's go,
Google.
let's actually go see somebody before
Right,
start
exactly.
putting the Google is the crazy thing. So
Absolutely.
what do you find most rewarding about what you do?
Oh, oh man, where do I start? I the most rewarding is when a patient says that I made her pregnancy journey or her experience better. That I would never forget that. This is a lasting impression that they will have for me for a lifetime. And
Mhm,
then they'll tell that baby and so forth. And so to know that I'm making a difference every day with a patient in this experience, that is the most rewarding for me. And for us, the IVF setting, the most rewarding would be the positive pregnancy test,
mhm,
especially for someone who's had a failed, miscarriage or a failed IVF cycle 2 or 3 times, to have that positive pregnancy test and then to see them go through that pregnancy journey is is rewarding. It's life changing. And
mhm.
so I would say those two are my most rewarding experiences.
I worked with a nurse in the military who had multiple miscarriages.
Hmm.
And they tried the IVF, and
Mm.
she had triplets. And
Ooh,
someone had said to her afterwards, "Would you have done this knowing?" And she said, "Are you kidding? This is the greatest thing that's ever happened. It would have never
right.
occurred." Okay, is triplets difficult? She said,
Hmm.
"Yes, but I wouldn't
Hmm.
trade it for the world." And the
Nope.
joy that I see with when I was in the military as a medic from moms when they become a mother. It doesn't matter how many times they become a mother, but there's
Hmm.
just so much. They're just ecstatic with the process, and anyone who can
Hmm.
make the journey easier is
Exactly.
is so important.
It
What you do
is.
is so important. Well,
Absolutely.
I love this conversation.
Hmm.
How do people get a hold of you?
So I'm on LinkedIn. You can find me under Lashell Jones. I'm mostly on LinkedIn, and then I just started for sonographers who are starting out in their journey. I have a few teaching courses on YouTube. It's under my business name, Ultra Pro Cert, which is ULTRAPROCERT. You can also find that same name under Instagram as well. But mostly my platform is LinkedIn. I believe that's where we met,
That's how we
Frank,
found
right?
each other.
Yeah,
Correct. Exactly.
absolutely. I've met
Exactly.
so many wonderful people from LinkedIn. It's really had opened up a lot of doors for me. And so that's my main platform usually.
Perfect. So, what
Mhm.
last words do you want to leave with the audience around the world today?
Ah, I wanted to just say we all, as healthcare providers as well as patients, let's just all be kind with one another, practice kindness. I tell that to my 6-year-old. I feel like I can tell it to everyone. Let's just all practice kindness. And, sometimes there is a pressure put on us healthcare providers. And just know we too are human. We too suffer heartache and loss and miscarriages. And so just keep that in mind for us healthcare providers. And so once again, I just want to say that I'm glad that I am a part of this OB journey, and I will hope to do this for another 20 years, Frank. We'll see. But Thank you for having me. I do want to say that, Frank. I appreciate our conversations over the last few weeks. And so I'm
Wonderful.
just excited. I'm so excited.
So am I. I think this is a topic that needs to be explored, needs to be talked
As,
about, needs to
yeah,
be not pushed in the corner. This is something that
no,
has to get out there.
I agree with you.
So as I said, we're just about out of time. I want to thank Lashell one more time for being with us and the importance of reproductive
Thank
health.
you.
Now, I
Yes.
try to keep political statements out of this, but this is important. It is not only about physical well-being. It's also
Hmm.
the right to respectful relationships for health services that are inclusive, that are safe and
Hmm.
appropriate, and allow
Hmm.
access to accurate information, which Lashell provides every single day, and effective
Hmm.
and affordable methods of contraception, and access to timely support and relationships on unplanned pregnancy. This is a family and a
Yes.
personal matter, period.
Hmm.
Let
Yes.
families make their decisions. Now, you can see this show on my podcast, which is called Life Altering Events. It'll be on Parade
Hmm.
Deck and my YouTube channel, and I will post it on several LinkedIn and Facebook pages. I'll also send the link and the video to Lashell, and she'll post it everywhere she posts her stuff.
Hmm.
Use
Yes.
the YouTube channel. Please subscribe. Now, let me leave you with this. None of us are in this alone. And the secret to walking on water is to know where the rocks are. And
Ah,
today, Lashell showed us where many of those rocks are. Join us again next week. We'll explore another life-altering event. Lashell, thank you again.
thank you. Thank you again, Frank.
My pleasure.